Hello and welcome. I'm your host, Marissa Jacobson. Our guest today is Dr. Tony Kollarmalil, Client Operations Medical Director for V Technologies. He has a great passion for physician education and risk adjustment coding and documentation. He's going to share with us some highlights from his newly released white paper, COVID-19 from a Risk Adjustment Perspective. Thank you so much for joining us today, Dr. Tony.
Thank you, Marissa, for having me. It's a pleasure to join you for this talk.
Thanks. We've all experienced and, certainly been impacted by, and in some way, this whole pandemic that plagued us for the past year almost. What, from that perspective, has motivated you to write this topic?
The impetus behind this topic was the pandemic hit the US around March, and a lot of us were scrambling to look to see what information there was out there from a healthcare perspective, to help our clients manage the situation, or even give them some ideas around how we could manage some of these patients, how we could help, how we as a company, V Technologies, could help identify these patients and which patients were more at risk for developing symptoms for COVID. And that was the impetus. I looked around to see what information was out there, put that as I could together and put it into one place to give a one-pager for our clients to have some information on what avenues we had to help them out.
So I think that's a really interesting point, what you just mentioned, Dr. Tony, and I think it will definitely help and impact our clients. How has this affected what's happening in the health industry? And, how will this then benefit the reader?
Yes, that's a great question. Well, in the past, the healthcare industry has struggled with the management of several of these chronic conditions that have now been identified as risk factors for patients who develop COVID. What these risk factors like diabetes, morbid obesity, so forth have done is that it highlighted the importance for accurate management, proper management of these conditions. And even for those patients who have had COVID, we've seen that many patients who have had dementia, for example, have worsened. So the management of all these chronic conditions is vital to the future of these patients and to the future of the healthcare industry as a whole, not just from a cost-saving perspective, but from a patient management perspective as well, because you have more chronically ill patients after COVID than you had in the past. And this would be a big burden on the healthcare industry as a whole.
Yeah, I really think that all that you've mentioned and this topic on a whole is really important, given the context of our world right now, obviously. And, just without giving too much away about the paper, can you share some insights as to what you'd like the reader to take away from the paper? How do you want us to, move forward?
One of the ideas, this is an idea that it's not something that I came up with, but what a lot of industry leaders agree upon is the way that isolation is not a great way to go about identifying these patients and then having everyone isolated at home. It just does not seem to work. But what the paper highlighted is that some systems went about it a different way. They identified patients that were at risk. Primarily the older population, primarily patients who have chronic illnesses, and then work to have those patients isolated, maybe at home, and provide them services at home so that we could mitigate the after effects of COVID, so that we could prevent these patients from getting ill. These patients, remember, are already ill. These are already patients. They already have these chronic conditions, and having them get sick with COVID would make, obviously, from a mortality perspective, is one thing, and also for making sure that their chronic conditions are managed better, all much more easier if you're able to identify these patients in the first place. And V Technologies has in the past done services like this, identify patients with chronic illnesses, so that from a financial perspective and from a population health care perspective, we're able to help our clients identify these patients and, if need be, even provide the data that they need for isolating these patients.
Right. Well, hey, thank you so much for that, Dr. Tony. And thank you for your time today. We hope that you enjoyed learning more about risk adjustment in today's world. To learn more, please visit us and download this paper right here on btechnologies.com.